Hey guys, it's Debbie Seidel Bittke, Dental Practice Solutions. Thank you so much for joining me tonight. I have Carlos Rodriguez. He is a hygienist in Georgia, and he is also a professional comedian. And tonight we are going to bring laughter together with dentistry. I just put a post on Facebook. Carlos, thank you for joining us. I just posted on
Thanks for
Facebook.
having me.
You're welcome. What do nachos, dental CE courses, and comedy and dentistry have in common? So let us know what does comedy have to do with dentistry, and how can we help our patients with comedy? Thanks, Carlos, for taking time out tonight.
Oh, it's my pleasure. Thanks for having me.
You're welcome.
Where would you like to start?
So I want you to tell us, does dentistry have to be so serious?
I don't think so. I don't think it. Well, there's times where you're delivering something serious, where of course we have to be professional. But 90% of the time, I think we can take things a little bit lighter.
Yeah, and
I might.
like, why humor? Why are you mixing humor in there with dental hygiene and dentistry?
Um, if we're going to be honest, the dental office isn't most people's fun place to be, even if they don't mind going. Nobody really loves going to the dentist. So I want their experience to be memorable to the point where they go, man, I almost had fun, or I did have fun. And hey, this isn't so bad. I can't tell you how many people have referred their family and their kids just because, we had a good time and joked around a fair amount. So,
Well, Carlos, I used to do this thing when I was a practicing hygienist. I still am practicing, but not on a daily basis. But when I was a hygienist at all of the offices when I was in Southern California, I practiced, at least 3 days a week. I never let patients leave without laughing, because most of our patients, I think most of them won't admit to, a lot of them won't admit to it, but they're nervous. You
oh
know,
yeah,
I was working yesterday as a hygienist in an office. It's not something I do that often, but a man, he said to me, I just want to let you know, I want to be upfront with you. I'm a little on edge about being here. And so, how can we help them? Tell us a little bit more about sense of humor and how we can bring them to a lighter side of dentistry.
well, for me, being a guy hygienist, and I've been a hygienist since '96, and I started in the Navy in '87. So I've been doing dentistry a long time. This is all I know how to do, and just teeth and jokes. That's all I got. And I mean, I'm a big dude. I look a little intimidating sometimes, and so I have to be likable quickly. And I just find that humor for me is a quick icebreaker, and just to get people relaxed and kind of drop their guard a little bit, so I can do what I need to do.
So, tell us, what do you do to humor your patients?
It depends. Everybody's a little bit different. Everyone's a little bit different. I I was joking around with a patient today. The lottery is, what is it, $1.6 billion. It's just some unreal number. So I was telling him, I go, did you get your numbers for tonight? And he goes, yeah, I did. I go, because if I win, no one's gonna know where I'm at. My mother's not gonna know where I'm at. And he just thought that was hilarious. I'm kidding, of course, but he was like, man, that's pretty. You're ready to run, right? It's just one of those things where I try to find some commonality, some common ground, because people like people that are like themselves, if that makes sense.
It
So,
absolutely
so
does.
I go,
That's building rapport.
what do you do? What kind of hobbies do you do? And I know a little bit. I've been doing this a long time, so I know a little bit about a lot of different things. And if somebody says cars, and we'll start talking about cars, or I'm here in the South, so we'll talk about guns, or hunting, or fishing, or whatever. And I just try to find a common link. A dog. What kind of dog do you have? That kind of thing. And who doesn't like talking about their dogs? So, or grandbabies, or whatever it takes. And so I just try to find that common link, and just go from there.
So, why did you decide to get into humor when you started out in dentistry?
Well, like I said, I've been doing. I've been a hygienist for over 20 years. Since I use comedy in the dental office, patients have told me you missed your calling. You should have been a comedian. This is the most fun I've ever had, and so I decided to try it. And it was the scariest thing that I've ever done. Is because you got to be a little crazy to tell somebody, "Give me that microphone. I'm gonna go talk to a room full of drunk strangers. I'm gonna say words, and they're gonna laugh at what I say." And you have to be a little crazy. But I was more afraid of waking up on my 50th birthday and never having tried than of trying and failing. If that makes any sense, you know.
Well,
So
I mean, you haven't even woken up on your 50th birthday yet.
no, that's next summer. But I'm so glad I tried it because I'm pretty decent at it, you know.
So tell me, what is one of the, okay, first of all, I want to tell our people that are watching this, you have a YouTube channel. And this is when I was like, oh my gosh, I loved your YouTube channel. I was cracking up. And if anybody needs to laugh, I mean, you told the funniest jokes. They were so stupid about dentistry. I mean, not to insult you, they were
No, no,
fun.
no.
They were just ridiculous. I just
Yeah.
had so much fun watching your YouTube channel. So tell us about that.
The name of the channel is What the Floss,
That cracks me up right there.
because it sounds like you're saying something naughty, but you're not.
It
And
does.
and sometimes you just gotta say, what the floss is going on. Um, so I have some stand up on there. I have a little podcast that I do that I'm about to change the format on that. Um, and just some funny clips of people, prank phone calls and that kind of stuff. Because at heart, I'm a 13-year-old child. I just have a better job than most 13-year-olds. Um, but yeah, life's too short. You gotta laugh because the bad stuff is coming. So you gotta have fun when you can. I think.
Well, wait a second. I hope bad stuff's not coming, Carlos.
Well, that's just life, though. It's just life. Not to bring everybody down. The last 4 years, I lost a family member every year, and it was just my
Wow.
grandma and my step parents, and just an uncle, and it was just like, man, I don't know. So, like I said, like I told you earlier, it's either laugh or cry. So, I'll make jokes, and that's how I deal with it. So.
So, well, what else can you tell us, Carlos, about how they can add humor? Can you give us some tips to add humor? I mean, a little bit more than you've given us. Any more meat and potatoes?
How to?
Yeah, like what? How can they? Like let's say you have somebody who's really serious. I mean, I've actually had some patients that were super serious, and they actually said, "Don't even talk to them and say the word floss." And you're saying, "What the floss?"
Yeah. Well, some people are, no matter what you do, you could be, dressed in a clown suit, and they're not gonna, they just all about the business. And I'll try a couple, try to start a conversation and see where it goes. And if they don't respond and they just want to get the work done, then that's fine. They got something on their minds, and, I don't take it personal. But I find that most people are receptive because they'd rather deal with, um, try to figure out what it is that you're talking about than deal with their own nervousness, if that makes sense. Um, I had a kid today, 16 years old, and he looked like he just rolled out of bed. He had his pajamas on. You know what I mean? His pajama pants on. And I go, dude, please tell me you brushed this morning. Please. He goes, yeah. I go, oh, okay. I thought I was gonna have to send you home. And his mother's sitting there, and she starts laughing. She's like, no, he brushed it. I'm like, okay, just checking. So it's just silly stuff like that, and just I'm sure we all have. Most of the dental people I know have a good sense of humor. They're just they pump the brakes and don't say what they're thinking. Um, I don't know. I don't know if it's professional or not, but I try to make everybody laugh if I can.
Yes, and those are the kids. I mean, I had two 10-year-olds on my schedule yesterday, and they were not doing a good job brushing. and I had fun with him as well. But you know, hopefully we can help add some humor. Why
Um,
did you decide to call it What the Floss?
because I didn't want to use any profanity. Yeah, when I started doing stand up, the whole goal was to somehow bridge stand up and comedy with dentistry. I just didn't know how. I knew that that's what I wanted to do. So I've been doing stand up just professionally for about 7, 8 years, and in just last year I've blended the two, and I have a couple classes that I do. If you go to whatthefloss.com, it'll redirect to the main website. And you can see some of the courses that I do and some pictures with different, comedians and celebrities and that kind of thing. But I dentistry is just too serious for my taste. Other people think that dentistry should be, with a tie and a suit, and I'm not that guy. If you put a suit on me, you might as well just put me in a straight jacket. It's just too much. Um, and I like to look at the lighter side of life. I think it's like I said, life is too short, and I try to find humor in everything. But sometimes it gets in the way because I don't see. I have a hard time being serious. I don't know if you've experienced that with our conversations, but I'm
No,
always joking around and I never take anything seriously, and it gets frustrating
no,
sometimes.
you look serious right now.
Yeah, no, because I'm just thinking, and I joke about, yeah, I've been married 28 years, and I
Congratulations.
thanks, and she's a great girl. She puts up with me, but sometimes it gets annoying because I'm always clowning around, and I never
Okay.
and I never turn it off. Like the other day, we're driving home from dinner, and the road is real foggy on the way back to the house, and I go, "What if we hit something and we think it's a deer, but it's not? It turns out it's a unicorn." And she goes, "That's the dumbest thing I've ever heard. Don't talk to me, right?" And I start giggling because I know where this is going. I go, "Just hear me out. If it was a unicorn, I would just pull it to the side of the road. He'd be so grateful he grants us 2 wishes. What would you do with your wish?" And she goes, "I wish I had a husband that didn't believe in unicorns." And I giggle all the way home because it's an accident that didn't happen on a creature that doesn't exist. And I can, so I'm always messing with her, and it gets annoying. I mean, I don't know. It helps me pass the time. So
But you know what, Carlos? I have to tell you one thing. That's marriage after 20 years. I've been married 20 years. Even if you weren't talking about
so you might
unicorns.
have to see a Bigfoot run through the backyard or something. I don't know. Just something to keep it interesting. You know what I mean?
Yeah.
How many conversations can you have? What do you want to do for dinner? You know what I mean? How many times have you had that conversation? A million times. And it's always, I don't care. And you go, Chinese? No, I don't want Chinese. I'm like, oh my God.
Oh my gosh. See, now I feel like this is a normal conversation between two people who are both married
That's
because we have
exactly
the
it.
same. But I tell my husband now, can you just decide for me? Like, I want him to make the decision for me.
Most guys don't care. We just want to eat something. You know? We don't care what it is. Like it could be a peanut butter and jelly sandwich with chicken noodle soup. I don't care. As long as I don't have to cook it, I don't care what it is.
Well, my husband asked me tonight what we were going to do for dinner. I said, sorry, I'm going to be on a Facebook Live. So he's making something on his own.
Oh, apologize for me, please.
Well, I'll just tell him that I was on a Facebook Live about humor and dentistry. What does comedy have to do with dentistry?
Yeah, I don't know. What does it have to do? What doesn't it have to do? I'll tell you this, that I think it starts off. It's more than just simple jokes. I try to create an environment where it's fun to be in. Like when I come in the morning, sometimes I don't feel like it. Like this morning, I didn't get my coffee. I was running a few minutes behind, and but I go in. I'm like, hey, good morning, and I try to say good morning to everybody as I walk in, and just go out of my way to pop in and just say hello. You know what I mean? And just start the day off with an acknowledgement. How you doing? Good morning. That kind of thing, and just to set the tone for the day. You know.
And I want to ask you something. How many times does the doctor or doctors where you work set the tone like that? Now that's a good question as to coming from a coach and consultant. because I think it's important for the doctor, who's the owner of the practice, the lead doctor, to set that tone, especially them.
Well, I get there sometimes a little bit later because I work later in the evening, so that's already been done by the time I get there.
Oh, okay.
But I like to do it myself. Just hey, are you doing okay? That kind of thing,
Uh-huh.
and just say some just silly stuff. Just even patients that are in the lobby. Like my last patient was alone in the lobby. It was in the reception area. There was no one else. So I stand there and I'm looking left and right, and she's looking at me like it's got to be me. You know what I mean? Who are you looking for, sir? I'm the only person out here. I'm like, are you, let's say, Debbie? She's like, yes. I'm like, yeah, I'm looking for somebody else. But it was totally her. I'm kidding. I'm kidding. Come on back. Come on back. So she's like, what the hell is going on? And we hit it off just great. So.
Well, I used to try to, I would always be joking around. And I had this one patient. He goes, Debbie, you are so goofy. And I was thinking about that today. Like, how do I take that when somebody's saying goofy? Like, okay, is that kind of strange goofy, or is that silly goofy? Because I like to play around too, especially in
Sure.
the dental office.
I think it's a good goofy. I have one patient who's her vision is starting to go, and the whole time we're working, I'm telling her jokes and crazy stories of just stuff that's happening, little trips that I've been on, and I can make a joke out of just getting on an airplane, and she'll go. Last time she goes, there's something wrong with you, boy. There's something wrong with you. I go, there's something wrong with me. There might be something wrong with you because you can choose who you see in 6 months, but you keep coming back to see me. And she goes, touche. You're right. You're right. I like you. There's something wrong with you, but I like you. And that's okay. But the point is, she leaves there going, this kid's crazy, but he does a great job. So, I'll put up with him. So I don't know. But
Well,
it's all an act. They know I'm just playing around. So, but some people you
yeah,
can't play with. You know the type.
I do.
I kill people with kindness, though.
I
You know.
know you do. I know
Yeah.
that personally from you. That's how I met you, because you were such a kind person. You were sitting in back of me at a course all day long, I think. I think you were in back of me
Where was that in
in
Arizona?
Arizona.
Yes, yes, yeah.
Yeah, I noticed that. A
So how was
gentle
your?
giant.
I'm sorry.
You're a gentle giant.
Yeah, I'm a big softie. Don't tell anybody though. But yeah. You have to be. I'm a hygienist. I got to be gentle. You know what I mean? I have to be nice. I have to be nice. And then I have young guys come through that you're like, hey, how you doing? And I have a 22-year-old son, so I'm around all the cool talk and the cool handshakes. I can't do any of them, but I try, and I fail miserably, and that's funny to young guys when I try to be extra cool. But even though I know it's not, but the fact that I try is still funny to young guys, if that makes sense. So they're like, this old guy is, I don't know who he thinks he is, but and I just have fun because I'm not afraid to look like an idiot. Is the point. So once I get them laughing, then I got them. Then they're on the hook, and they're gonna listen to whatever I have to tell them. So
Yes,
I
yes.
don't know.
Isn't that funny how you learn something? Like my husband and I were teaching Sunday school at our church for a while, and the kids would do this. I think if I did now, see, I don't remember if this is correct, but they do this fist bump and they go like this with their hand. It was in some movie, they said. So
Okay,
my husband
I'm
always
not
did
cool enough. Yeah, I'm not cool enough to pull that off. I don't know
that.
the combination.
He does this now just to be funny with the kids. It's kind of fun. Kids love that, especially in the
Oh
dental
yeah.
office. But I mean, I think it's those, like that lady, what you did today when you were looking around the reception area and she's the only one out there. I mean, that's pretty funny. I mean,
Mhm.
I think it's important when you do that more often than not, because I suspect 50% of the people that come into a dental office are not happy to be there.
No, it's going to be uncomfortable. It's going to cost a lot. They don't want to be there. So I try to make it fun. Another thing I like to do, and I don't know, this just occurred to me. I'll sit at the front desk sometimes while I'm waiting on the patient, and they'll bring a patient up from the back, either hygiene or one of the doctors, and I'll spin around and I'll take the care slip like I know what I'm doing, and I'll go, wow, and I'll just start hitting keys like a lunatic. You're like like somebody who's typing really, really, really fast. I'm like, yeah, that's gonna be expensive. And they're like, wait a minute, what's he doing? I go, let me get out of here and find somebody who knows what they're doing. I'm just messing around, and they just have the funnest time. They're like, who does that guy work here? What's the deal? Got a name tag, buddy. I got a name tag. So it's and it doesn't hurt anybody. It doesn't, I'm not killing it. I'm not wasting any time. It's just a little something just to get them to smile. And, you hit them with a big goofy smile. And most people, it's hard to not smile back when somebody's being nice. You know what I mean? So
Yesterday I had this gentleman in my chair, and he's like, well, I haven't seen you before. He's like, anything I should know about you? And I go, well, the good news is that it's not my first day as a dental hygienist. I've been doing this for the majority of my life.
Like, so settle down,
buddy. To make a joke as well.
I've done this once or twice, right?
And then at the end of the day, thank goodness, they're like, well, where do you normally work at the office I was at? I'm like, well, I don't normally work in adult. What? You don't normally work in a dental office? I'm like, no, I'm a consultant, and I just was doing this for fun. I seriously wanted to just, I don't know, sometimes it's like I'm with my client and I'm showing them things, and I kind of miss being in the dental office as a hygienist. Sure. And I just love that scraping on their teeth and gums. Seriously, it was giving me pleasure to do that yesterday.
It is fun. It is fun sometimes, So, yeah. I don't know if I want to do it every day, all day anymore, but it is fun. I think you have to enjoy it. Nobody does this for 20-something years, and you kind of sort of like it. You like taking care of people, and I don't want to just clean teeth and just be mechanical about it. I said this the other day. I was in Utah with the Dental Intel guys.
Yeah, I saw that.
And I was performing. I did an hour of just stand up, and it was just amazing. And this came to me while I was out. I like to write on stage, like something comes to you as a new punchline or whatever, and it's just very organic. And what I said was that I don't treat patients. I build relationships and make friends, and then I just happen to clean their teeth when they're there visiting me. You know what I'm saying? So I don't want to just do the work. I like to connect with people on a personal level, I guess. I have some patients that I've seen for 15, 17 years, and it's like you follow the course of their life, like their kids in college, the kids graduating from college, the kids getting married, the kids having a baby, they're a grandparent now, and they bring pictures of the kids. And it's just fun because you see a snapshot of this person's life in 6-month increments, and you kind of feel like there's a connection there. You know what I'm talking about, right?
I absolutely do. And patients must love hearing about your life as well as being their hygienist, because I remember working in an office for about 10 years, 4 days a week, and my patients came in all the time just to catch up and hear. Sure. I mean, they knew that they were getting a really great preventive care appointment with me. They totally trusted me, and they knew that I was an educator. At that point, I was a clinical assistant professor at USC teaching the dental students, the dental hygiene students. But we also had fun, and we had the key word that you said right here is connection. And I think that's what comedy can help you do, is really connect on a good level, like a relaxed level, where people, if a person, I was talking to you before we came live, and I've done a lot of research and a lot about what goes on in the brain when people are in the dental chair. And it's really important that we have a certain posture and a certain tone. And I think that laughter can totally cut through any icicles that are there as a barrier between us and getting our patients to want what they need.
I agree. I think you have to demonstrate your clinical prowess. You got. I talk to them and explain treatment plans in an intelligent way. But then again, I can switch gears, and now we're talking about what do you think, about Bigfoot or whatever. Just some ridiculous nonsense. I I don't know. I just have a lot of fun, and I have a handful of patients that we don't even start working. We just chit chat for about 10 or maybe 10, 15 minutes before we start,
Well,
and
those are the patients, Carlos, I bring in before lunch or at the end of the day.
right, right, yeah, yeah.
I know
So
who those people are.
I never get an hour lunch. I don't know what that means. I don't know what that feels like. I never finish on time. So, but it's I think the patients enjoy. I enjoy doing it, and I don't know. I'm having a good time for as long as I can. Um, they come in sometimes. They're like, you're still here? Where have you been? Oh, you were going on a cruise last time. How'd that go? And I'm like, oh, it went great. I was in Utah. What were you doing in Utah? So it's just fun stuff like that where they're following me the same way I'm following their lives and their dental health and that kind of thing.
So,
Um,
Carlos, I want to tell you something. You're a very humble man, and you do have quite the following. And it's a good thing your wife isn't watching this, I hope, because you have a lot of women that are commenting on you while you're here on this Facebook Live. And they do think that you're a rock star and that you're
oh, please.
hysterical. So they've been actually putting some emojis in there with they're laughing so hard they're crying.
Good, 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 good.
So
I, I think
yeah.
if you can make someone laugh and change their mood, to me that's like a superpower. I had a guy 6 months ago, and I just saw him again recently, a week or two ago, and comes in real quiet, and so I'm doing some tester jokes on him, and sometimes some of my patients, they open up to me and they use language that's inappropriate in a dental chair, but the fact that they do that is telling me that they're comfortable enough, that they trust me enough to talk to me that way. All right. So I'm hitting this guy with this crazy joke I do about going to a doctor for a physical and how I'm passive aggressive, and I took all the paper off the exam table and just took a nap. Anyway, it's ridiculous, and I got to tell it to you sometime. It's like a 7-minute joke, and it's I use it to close a lot of times. This guy was laughing so loud we had to stop. He's spitting water everywhere, and he goes, you don't know the kind of week that I've had. Thank you so much. Did you do this all the time? I'm like, yeah. I don't turn it off. And he's like, can I see you next time? And it just made me feel good. And if you're laughing at what I say, then we're gonna be friends because I like to make people laugh. Maybe it's selfish of me that I like to make people laugh, but I think if you can, like I said, if you can change somebody's mood and oxygenate their blood and leave them feeling a little bit better or forget about whatever's bothering them for 30 or 45 minutes, then you did that person a service other than just clean their teeth. You sort of made them think of something, and he was still laughing about that stupid physical, me going to the doctor for a physical, and it is absolutely ridiculous, but and it's on purpose. Just it's supposed to be just a horrible mental picture of me just having a physical and just not being happy that I'm there, and he enjoyed it immensely. So, and now we're like buddies. He follows me on Instagram, and it's just ridiculous.
Oh my gosh, that sounds like so much fun. So, Carlos, I'm going to put you on the spot, and then
Okay.
then I'll let you go. But I wanted to put you on the spot if you don't mind. Do
Well,
you have? I want you to put your thinking cap on now
okay.
and think of something funny, one of your dental jokes. That's about 60 seconds. Do you have one?
Well, yeah. Well, one of the main ones that I use is that I don't look like a regular dental hygienist. I look like security at Walmart. I had a patient, and she goes, Anybody ever tell you you kind of look like a fat, angry Vin Diesel?" And I was like, "Wow, that's not nice. Get in the chair, ma'am." She's like, "Take it easy, Fat and the Furious. Take it easy." And I'm like, "Oh, you got jokes, huh?" she's toothless right now. How's that applesauce working for you, wise ass? You know, so that's I do that on stage because I don't look like a hygienist. I got fat hands and vitiligo like Michael Jackson. I got it all over. When I'm at the beach, I look like a Puerto Rican panda. It's ridiculous. People try to feed me celery. I'm like, get that out of my face. Put some ranch on it and come back. You know? I don't know.
You do.
So
I mean,
just go
I was
on
like,
and on.
I was there in this class with you for a few days, and I'm like, who is this guy? Who is he? You know, because you don't look like a hygienist. I thought maybe you were a dentist, but I'm like, okay, well, he's somebody I would like in the alley at night in the dark with me because he looks like he could protect me.
Oh, like he's a big titty bear. It's funny when I'm at the club working doing stand up, people think I'm security. They're like, "Do we show you our tickets?" I'm like, "I'm a comedian, man. I don't know what you do with your tickets. Go around the front, you know." I don't know. It's fun. It's good to look scary, but my wife's maybe 130 pounds, and she's like the little Chihuahua who has the big bulldog afraid to death. You know what I'm saying? Oh,
Well,
yes, ma'am.
somebody just posted on our Facebook live here that you have blue nitrile glove. Your hands are blue and nitrile.
Yes. Well,
What's up
at
with
work?
that?
What do you mean?
Well, she says that you have scary nitrile blue hands.
Well, I got big hands. I don't know what I don't know what that means.
I don't know,
Like
but
Dexter? What are you talking about? What does that
I
mean?
don't
I don't
know.
know.
We've got some people that are sharing some scary tips and funny things about you here now. I think we should probably keep this going because we have a lot of your fans coming on this Facebook Live now. They must be creepers at night because it's
That's a you know
on the East Coast. It's late now.
they're out there, man. They're
They're
out
all
there.
coming on. Maybe they're trick or treating with us tonight, Carlos, because all your friends are coming on here now.
You know, I got a bunch of crazy friends too. So you know.
Oh, so yeah, we have maybe Krista wants to hear a joke. Krista wants to hear another joke from you.
Well, one of the ones that let me say, I lost my voice a few weeks ago, and everything I said in the dental office came out very aggressive, a little suspicious. Simple stuff like open your mouth. You know, it just sounds very aggressive. You know, and so I was telling my manager, I was like, "Can I go home? I just don't feel good. My voice." And she's like, "But you're fine. Just whisper. Just whisper. What can go wrong?" And I'm like, "Look at me, man. Nobody that looks like this needs to be saying in a dental office, close your eyes. You know, I can't whisper. You know how creepy that is? That's horrifying. I can't, you know, this isn't gonna hurt at all. No, that sounds horrible. I gotta get out of here. I can't work here today. So no whispering for me. If I can't talk, then it's a wrap. I gotta go home. But yeah, I don't know. Is that enough? I mean, I got we could do this all night, but
Well, I think your friends are coming on here live, so if you want to give us a few more jokes, they're enjoying this. We've got a lot of people that are watching you now.
Well, one of the things that happened to me recently is I got into an argument with a magician a couple weeks ago, and which is insane because that's a sentence that should not exist. I got into an argument with a magician. You know, see how crazy that sounds?
That's scary.
Well, I was at a show, my buddy was running it, and this guy comes up to do magic, right? Sleight of hand, whatever you call it. And he was too late to get on, and he thought I had something to do with it, and he's all sore at me. And I'm non-confrontational. I like to de-escalate, but I'm not taking any crap from a guy who uses the word ta-da on a regular basis. I'm not doing that. If you say abracadabra, I'm going to say some stuff back because that's not a fighting word. You know what I mean? He even sent me a message, true story, on Facebook. It said if I didn't apologize, he was going to punch me in the mouth.
Oh.
And I was like, are you crazy? I go, you want an apology? He was like, yeah, maybe we can put this behind us. I go, well, if you want an apology, hocus pocus, buddy, you're not getting one. You know, settle down, Voldemort. I didn't do anything to you, you know? So I think that made him angrier, calling him mythical wizards from Harry Potter, you know?
Well, I was thinking that's kind of scary to mess around with a magician because they could make you disappear and decide when, maybe
You,
years from now, that
you
you'll
know,
return.
I'm not afraid of a magician. I'm sorry. If anybody does magic, I apologize. If your kids do it, that's great. But a grown man, hey, what's that behind your ear? I mean, that's the dumbest thing in the world to me. Actually, an angry magician would probably be more fun than whatever crap he was going to do that night.
You know what? You should make up a joke around this. That would be so funny.
I tell this story on stage because real life is insane. Real life is crazy. Like I got into a car accident about 6 months ago, and I had to get a rental car from Enterprise. I go to Enterprise, and the lady rented my vehicle, and I'm like, how does this happen? I just talked to somebody 12 hours ago, and she goes, I don't know, sir, but we're gonna make it right. We're gonna get you an upgrade to an SUV. And she goes, what do you think? I'm like, I don't need an SUV. They're too big. They use too much gas. I drive all over the Southeast. You're going to kill me. She goes, it's a small one. You're going to love it. It's a Hyundai Tucson. I go, Tucson?
Tucson?
Do you mean Tucson? You moron. She goes, Tucson? Is that how you say it? I'm like, yeah.
Oh my gosh.
And she goes, what's a Tucson? I'm like, seriously? It's a city in Arizona. It's right next to Phoenix, which you need to get hooked on. She was like, what? I go, never mind. Give me the keys. You're too dumb for me to talk to. Hurry up. I got to go to Knoxville this weekend. Give me the keys. Unbelievable. And, a lot of that just started off. She did say Tucson. So I just take the rest of that and just make up, like, where would this go? I don't know. But everything is funny if you look at it the right way.
Funny. Carlos, thank you so much for the late
my
night
pleasure.
coffee here.
Thanks
You have
for having me.
A lot of fun people that are watching you right now, and hopefully we can get together again for some late night comedy. I think it was great. We did this because you were working today, but we've got a lot of people that are coming on and interacting with us and enjoying your jokes. And
thank you everybody for tuning in. Yeah, we should probably plan something so I can come out west to where you are and do like a CE/comedy thing, and get your people to come out.
You know what? If you guys are watching this, let us know if you would come out to Portland, Oregon. I've got a place in mind, or we can. I'm connecting with some people in Orange County, California, as well. We could do something there in Newport Beach, Santa Ana, or Portland. Let us know if you guys want to come and see Carlos and myself. He can probably make some jokes about me and my red hair. And I used to have a lot of freckles and buck teeth, believe it or not. That's not funny. But
I wouldn't tease you.
I always love to have fun. When we're coaching and consulting, I know last time I was in an office recently, some people, they actually admitted they were extremely nervous that I was there in their office as their consultant.
Really?
And so I try really hard to make it fun. We do a lot of laughing. In fact, my client, he's like, Debbie, that night he goes, do you think that we're having too much fun? I go, you know what? I think it really helps to make it fun. Like we were learning a lot, but we were laughing hysterically. We were having fun. And a lot of this is playing on words too, like you were saying.
I think people learn more and they retain more when they're having fun and engaged. How many C's have you been to where you're falling asleep? You're not going to fall asleep if I'm on stage. I can tell you that much. But
I know.
So I'm trying to rent comedy clubs and hook up with local different hygiene groups and do my CE. And so
Okay.
So if there's any cities that you have a big following in, or if anybody's watching that wants to hit me up on whatthefloss@gmail or on Facebook or whatever, and you have a big group that wants to come out, we can rent a club and we can try to get out there and do something fun and interesting. So
so Dental Practice Solutions, we have the AGD credits, so we can give the CE course and we can do it in a comedy club. We can have fun. Can you guys let us know? And then also reach out to us. I mean, we would love to hear from you guys if that's what you want to do, because we're always doing CE courses. And Carlos and I have seriously talked about doing something together. So I want you to email our office, admin@dentalpracticesolutions.com, and let us know. Carlos, out of respect for time, it's getting late, and
I get it.
we're going to put this up on our YouTube channel for Dental Practice Solutions, and I'm going to share this with you, Carlos, so you
Please.
can put it out to all your friends
Yes,
and
ma'am.
your
Thank
following. So if you can ask them to let us know if they would like us to do something
you.
together.
Most
I'm happy to do
definitely.
that. Either, I'm originally from Southern California, and then we've got
Nice.
connections here in Portland as well, so we can do something together there. So guys, please let us know if that's what you'd like to see. And if you come west, I know Carlos is on the East Coast, but we can make arrangements for him to come west. And
They have planes now. We can totally make it happen. So
we can, yeah, we've got our Lear
yes.
jet we'll fly you out on. So
Awesome. Guys, thank you
so
so
Carlos,
much.
you're welcome. Now tell everybody how to get a hold of you, where they should find you. What's the best place to find you?
Well, I'm all over social media. I have the YouTube channel, What the Floss, or, What the Floss at Gmail, or whatthefloss.com. And that'll take you to the main website if you want to see some of the speaker stuff. So
yeah, I
just
had
a little bio information.
Put some more. I hope you have more stuff on your YouTube channel. I watched everything so far as a month ago. So
Okay, cool.
I had a good time watching it.
Thank you.
If anybody needs a good laugh, YouTube, What the Floss.
Absolutely ridiculous.
A lot of fun. Carlos, thank you so much. And
Yes.
I'm going to end this, and then I'll chat with you in just a moment.
Sure.
So thank you guys for joining us. We'll talk to you soon. We hope to see you on the West Coast.
So thank you guys. Have a good night.
Good night.